Hi everyone, welcome to Friday Reading Live. This is me Vandana PS joining you from Neethu's Academy. Yes, we have another new topic here. So as usual, first of all, we'll be dealing with a sample question from the part B. Then I'll give you 2 minutes for the completion of this question. Then we will discuss the answers. So here is the question. Yes, so the time is over. So here is the question the manual talks about. So this is a manual which we are reading for the main idea. Okay, so which comes under the second category from part B. So this is a manual once again, and we are reading for the main idea. So the manual talks about. So option A, safety procedure. So my keyword from option A is safety. Then option B, health hazards of mercury. So my keywords, hazards as well as mercury. And option C, process of managing spilled or leaking mercury. So my keywords, process, managing, spilled. So these are my keywords from these three options. Okay, so either you can read the question, then read the options, and you can go to the paragraph. Otherwise, you can read the question or the paragraph and you can find out your answers from these three options. Clear? Okay, so what about this paragraph? Common occurrence management. Okay, see, in the heading itself, they have mentioned regarding it's all about the management. Okay, so when you read a manual or a policy which comes under the second category from part B, definitely the title is going to give you a lot of clues. Okay, I'm not saying that always the title is your answer. It will give you a clue as well as the last lines. Okay, yes. Then, if you discover a mercury spill, you should not attempt to clean up for yourself. Then do not touch mercury with your bare hands or attempt to vacuum or clean up the spill. Leave the area in which there was a spill, taking the SP to separate waiting area. Close the door to the room, to the area or room if possible. Immediately notify the MEC manager and NCHS staff. The MEC physician is trained in mercury spill procedures and will clean the spill. Obtain replacement equipment. Okay, so such as very small question, very small options and very small paragraph, right? Yes. Okay, so any right answers? May I know your answers here? Oh my god, a lot of correct answers. Hi 𝐻𝐿 𝐉𝐮𝐥𝐲-𝐀𝐮𝐬𝐭, Joycey, Vidya, Soumya, Preeta, Sarala, okay. Yes, Reshma, yes, good afternoon. Hi Ammu, good afternoon. Okay, so a lot of correct answers. So what is your answer? Yes, it is option C. So how is it option C? Okay, any idea why it is option C? So what is option A? Safety procedure. So what are the safety procedures mentioned here? Okay, may I know what are the safety procedures? Okay, so here they have mentioned about if you discover a mercury spill, if you notice a spill, then what you have to do, how you can manage it. Okay, so it's not about the safety procedures, it's all about if you notice a mercury spill, then how you can manage it. So that is why I already told you in the previous, it's all about the management. Okay, so that you can eliminate option A, not mentioned. And what about option B? Health hazards of mercury. So what are the health hazards of mercury? What are the dangers of mercury? Nothing mentioned about the danger or the health hazards of mercury. It's all about option C, process of managing spilled or leaking mercury, and that is the correct answer. Clear? I know that majority of you are gonna write exam tomorrow. May I know it in the comment box? How many students are here who are gonna write exam tomorrow? Okay, any students? Okay, very good, Joycey. Yes, not mentioned A and B. Very good, dear. Okay, Anu, Prima, Binsi, Divya, Betty, Binsi, Ammu, 𝐻𝐿, then Reshma, then Kamlesh, okay, Sarala, Preeta, Soumya, Vidya, Joycey, Yogeshwari. Okay, everyone got the correct answers. I'm so happy. Okay, yes, guys. So now let's talk about part B. Okay, let's condense everything regarding part B. So what do you know about part B? So only after the completion of part A material, they are going to provide you part B and C. Okay, so this is total 45 minutes we are going to take for part B and C. So this is a 1 hour exam. Okay, or I can say 60-minute exam. So within the 60 minutes, we are taking just 15 minutes for the completion of part A, and the rest of the time, which is 45 minutes, it is for part B and C. Okay, so what about part B? What is the stipulated time period for part B? Hi Jyoti, good afternoon. How are you, dear? Okay, yes, coming back. What about the stipulated time period for part B? Out of this 45 minutes, then what about the timing? Any time period for part C? Okay, so part C is all about 33 minutes. So what about part B? You can take almost maximum of 10 to 12 minutes, not more than that. Okay, so for part B, we are taking a maximum 12 minutes. Then number of questions. Okay, it's all about total 6 questions in part B. And what about the type of questions? So 10 to 12 minutes maximum, then 6 questions in total. Then what about the type of question? I can say multiple choice questions with 3 answer options. Okay, so it will be very easy for you. Just read the question, then read the options, read the paragraph, find out the answer. But it's not that much easy. Okay, yes. Then what about the next one? That means strategy. Okay, for every part we have a particular strategy or method. So what method we are going to do here for part B? So the method can be called what? It's called elimination method, or you can say elimination strategy. So what is elimination? Okay, if you are eliminating particular options, I can say in part B, we have 3 options, right? So one option will be not mentioned. Okay, when you read the paragraph, you will understand, okay, this particular option is not mentioned anywhere in the paragraph. So likewise, you can eliminate one option. And next option will be not mentioned. Okay, so that is the first one, not mentioned. Second one, contradictory option, or it may be, opposite option. Okay, and you will get a correct answer. And it can vary according to the question pattern. Maybe in this question, 2 options are not mentioned. So what is the correct answer here? It's option C. So depending on the question, it can vary. Okay, so basically this is the procedure, I can say, elimination method, and one option will be not mentioned, one option will be opposite or contradictory option, and one option will be the correct answer. Clear? Okay, so that is all about elimination method. Okay, and in part B, okay, they will not give you any direct answer from the paragraph. Okay, in part B and C, it's all about paraphrasing. So what do you mean by paraphrasing? Okay, so what is paraphrasing, Shija? Any idea? Okay, Jubi, you got the correct answer, dear. It is option C. Yes. Yes, Vidya, it is 12 minutes, dear. Yes. Okay, so what is paraphrasing? If you know what is paraphrasing, definitely you guys are gonna clear part B, for sure. So what is paraphrasing? Any idea? So paraphrasing, which means the same meaning but entirely different sentence structure. Okay, the meaning will be the same. Okay, so please understand the difference between synonym and paraphrasing. Okay, synonym, which means same meaning, okay, different words. But paraphrasing, which means same meaning, different sentence structure. Okay, so in part B and C, it's all about paraphrasing. So don't ever think that if a question if a direct answer or a direct line from the paragraph, if it is in the options, don't ever think that that is the correct answer. 99% that will be the wrong answer. Okay, so it's all about paraphrasing. Okay, Doshna, a sentence with different words. A sentence with different words, yes dear, but still the meaning will be the same. Okay. Okay, Kamlesh, answer is there, but it will be different meaning, like synonyms and words. Okay, words with different meaning, which means synonyms. Okay, paraphrasing, which means the entire sentence is different. The sentence structure will be different. Okay, yes. So that's all about part B. So now we are moving to the new topic, as usual, part A. Okay. Yes, so before moving to the new topic, we are going to discuss about an overall idea. Okay, we have to get an overall idea regarding part A. So now tell me in the comment box, so what do you know about part A? Every day, each and every day is kind of a revision, right? Yes. So please let me know in the comment, what do you know about part A? So when you start, okay, something, you can start with the timing. So what about the timing? For the completion of part A, what about the timing? How much time do you need? So it's all about 15 minutes. Okay, so we can take 15 minutes for the completion of this particular part. Okay, and see, if you are doing additional materials regularly, if you are attending the lives properly, definitely, okay, trust me, you guys can score 20 out of 20 for part A. Trust me. Okay, so yes, it is all about the timing. Time management is the major thing in part A. So you will not get, okay, you will get only 15 minutes, not more than that. So please complete part A within this period of time. Okay, so with a lot of preparation, with a lot of doing additional materials, definitely it will be possible for you to complete part A within 8 minutes. Clear? Yes. Okay, so how? So that is the next question then. How? Within 8 minutes, how is it possible, right? Yes. So for that, we have to apply a technique called skimming and scanning. Okay, so when you take a material for the first time and when you're applying this technique for the first time, you're not gonna complete part A within 8 minutes or within 15 minutes. It's not possible. Okay, everything will be possible only after regular practice. Okay, through hard work. So about part A, I can say it's all about 20 questions, and we are doing the technique or the strategies called skimming and scanning. So what is skimming and what is scanning? Okay, so we should know about what is skimming and what is scanning. We have an idea, or we have heard a lot about skimming and scanning, but we have no understanding, we have no comprehension regarding what is this. Okay, so skimming and scanning. As the name itself, as the name indicates, skimming, which means we are just fast reading. Okay, so we are just fast reading everything. So that is called skimming. And we don't understand a single word. When you read, when you skim read, when you fast read, you will not understand a single thing. Okay, you can fast read because you know the language, you know the words, you know the letters. That is why you are able to skim. So what is scanning? Scanning, which means you are searching for some important words from each of the texts. Okay, so actually the latter one is important. What is the latter one? The second one? Scanning is important. Okay, so when you fast read, scan through it and pick some important words from each of the texts. That's going to help you to locate your answers. Clear? Okay, so everyone, okay, commenting so well. Yes, Reshma, skimming and scanning. Ammu, skimming and scanning, fast reading. Okay, so when you, you guys know that it is fast reading, but scanning, it's different, okay, searching. So, fast reading plus searching. Okay, Vidya, part A, 20 questions, 15 minutes, dear, yes. Okay, Kochu, skimming, scanning, yes, Doshna, fast reading and searching the answer, very good, exactly. Okay, Reshma, fast reading and searching words, very good, very good. Shija, skimming, fast reading, scanning, underlining keywords, excellent. Okay, yes, Vidya, fast reading. Okay, so yes, now tell me, when you skim and scan, what are the important words that you are gonna mark? So what are the words? May I know? What kind of words you will mark? What are the important words? And you know that when you read text A, text B, text C and text D, you will definitely mark some important words, right? So what are the important words? How will you know that these are the important words? Any idea? Yes, okay, Prima commented that fast reading and searching important words. So yes, that is my next question. What are important words? What do you mean by important words? Okay, Kirtu, yes. Headings, subheadings, numbers, names, then what else? Okay, so what else? So we have to by heart it. We have to study it, right? Okay, so we have to study these 13 important keywords from part A. Okay, definitely it's gonna help you. Okay, so yes, what are the 13 important keywords? May I know what are the 13 important keywords? Okay, headings. Okay, Reshma, headings, subheading, all signs and symbols, bold letters. Okay, dear. Okay, Juby, heading and subheading. Then, okay, so what if there is no heading and subheading? What will you do? Okay, Amu, 13 important keywords. So let me know what are the 13 important keywords. Okay, Juby, numbers, Italian. It's not Italian, okay, dear. Italics. So some words that are in italics or bold letters you can mark. Okay, maybe para first line and last line. Yes. Oh, yes, very good. Okay, so we have to mark some important words. What are they? Heading. Okay, so now itself by heart it. Heading. Second one, subheading. Third one, what is the third one? Heading, subheading, numbers. Okay, so mark all the numbers when you read or when you skim and scan through each of the text. Okay, all the numbers, Then fourth one, signs and symbols. So may I know any symbol? Do you guys know any signs and symbols? So let me know in the comments, what are signs and symbols? Okay, for example, equal to is a sign. Greater than is a sign. Okay, less than is a sign. So likewise, we have a lot of signs. What do you mean by a symbol? Okay, percentage is a symbol. So likewise, when you skim and scan, mark all the signs and symbols. Then what is the next one? All the names. So what do you mean by all the names? Pronouns. So what do you mean by pronouns? Okay, maybe name of a person, name of a disease condition, name of an instrument, equipment, name of a medicine, name of a country. So whatever names they have mentioned here, mark all the names. Okay, so we know that what are names, right? Yes. Okay, then what is the next one? So heading, subheading, numbers, signs and symbols, names. Then the sixth one, it is abbreviations. So what do you mean by abbreviation? Short forms. Okay, so you can write short forms into your answers if it is mentioned. Okay, if not, don't write it. So sixth one, which is abbreviation. Then seventh one, brackets. So whatever important things they have mentioned in the brackets, you can mark it. Okay, so those are brackets. Then eighth one. So what is the eighth one? Other than brackets, what else you can mark? Any idea what is the eighth one? May I know what is the eighth point after brackets? Okay, so after brackets, may I know in the comment? Heading, subheading, numbers, signs and symbols, names, abbreviations, brackets, and what is the eighth one? Okay, already you guys have, yes, commented it. It is italicized or bold words. Okay, you don't have to mark it, but still for a safety, yes, we can mark bold and italicized words. And the ninth one, okay, the words that indicate time. So what are the words that you know regarding associate with time? Okay, so the words like previously, after, okay, early, then delay, currently, presently, now. Okay, yes, okay, article. Yes, I will tell you regarding articles. Okay, Juby, I'll tell you that. Okay, so the ninth one is all about time. Okay, then 10th one, the words which indicate what? Research. So before that, the words indicate experiment, clinic, observation, diagnosis, identification, ascertain, okay, finding out something. So that's all about the words which are related with clinic, okay, or experiment. Then the 11th one, the words that indicate research, okay, study, population, percentage, I mean, yeah, the word itself, okay, percentage, word regarding something, prevalence. So that all words which are related to research. Administration, yes. Okay, then the next one, you don't have to mark it, okay, but just give a special focus to the first and last line of each and every paragraphs, as well as all the bullet points. Okay, so these 13 important keywords will help you, definitely will help you to clear part A, and definitely you will get 20 out of 20. Okay, so coming back to your comment, Juby. Okay, what is the importance of articles? So what are articles? So we have 3 articles, a and the. Okay, so what is the importance of articles? If it is indicating a particular thing, okay, you have to mention that article in front of the word. Okay, especially when you write short answer questions, it is important. What is important? To write articles. Okay, if the article is mentioned in the question, maybe sometimes they will mention the article in the question like a and the. So there is no need to repeat that article into your answer. Okay, if it is not mentioned and that article is in there in the paragraph, you have to write that article in front of the word, because articles are important in this particular exam. Clear? Okay, Juby, is it clear? Okay, Amu, you have taken a lot of effort. I know that. Heading, subheading, numbers, signs and symbols, short form, abbreviation. Dear, short form, that is same with abbreviation. Okay. Brackets, bullet points, time, experiments, research. Very good, excellent. Okay. Yes. Then coming back to part A. So yes, what are the keywords here? So now let's mark the keywords from text A. Okay. So what is the topic? Hypersplenism. Okay, hypersplenism. So I'm just marking the first word, the name of this condition. Okay, yes, hypersplenism. Okay, yes. So before that, may I know what are your keywords from text A in the comments? Now you guys know how to mark the keywords, right? So may I know what are the keywords from text A? Any idea? Yes, Jubi, Ammu, Aina, Doshna, Nebi, Jubi, yes, Kirtu. What are the keywords from text A? What are your keywords? So hypersplenism, then I'm marking when. That is a time which that is a word that indicates time. Then spleen, filter out and damage cells in the bloodstream. When your spleen becomes over enthusiastic or about filtering your blood, it removes too many blood cells too soon, leaving you with a deficit of blood cells, cytopenia. Then hypersplenism may lead to deficit of certain types of blood cells or all of them. You might have anemia, leukopenia, thrombocytopenia. Then hypersplenism can be mild to severe, and so can be deficit of blood cells you are left with. Hypersplenism can be classified into three categories by its etiological causes. They are primary hypersplenism, secondary, primary, and occult. So that is the third one. Okay, so these are my keywords from text A. So what about you guys? Okay, Kirtu, cytopenia. Then anything else? Any other words? Okay, so now moving to the second text. Okay, so which is, I'm just marking the title, cause of hypersplenism. Okay, so what are the words here? What are your keywords? Okay, so splenomegaly, that is my first keyword from text B. Then hypersplenism, liver disease, conditions affecting your liver. Okay, that is particular body organ, right? Then such as chronic hepatitis or cirrhosis can cause pressure to build up in the blood vessels that run through your liver and spleen. This is called portal hypertension. Okay, I'm just marking this particular word, portal hypertension. It causes the blood volume in your spleen to increase and your spleen to swell. Then infections, okay, all the sub points. Viral infections such as mononucleosis and HIV, bacterial infections such as tuberculosis and endocarditis, and parasitic infections such as malaria, toxoplasmosis stress the immune function of the spleen. They can cause it to overproduce antibodies and immune cells. I'm just marking the word antibodies also, as well as immune. Then overproduction of hyperplasia. Okay, autoimmune disease, I'm just marking this one. Then inherited metabolic disorders. Okay, the name also, Niemann-Pick disease. Okay, as well as Gaucher disease, sickle cell disease. Okay, so that's all about my keywords from, another some name of some disease conditions here, lupus, sarcoidosis, and rheumatoid arthritis. Okay, so these are my keywords from text B. Then we have a pictorial in text C. It's all about the diagnosis. Okay, so we have a lot of important words here. Just look carefully what is this diagram. Okay, so you can give just few seconds for this close outlook of this particular diagram. So here they have mentioned about hemodynamically stable, then abdominal CT scanning, then splenic injury, I'm just marking, blush on CT. Okay, observation is mentioned here, that is related to clinical observation. I mean, yes, the word for experiments. Okay, yes, then splenectomy, splenography. Okay, so these are my keywords from text C, and it's all about treatments from text D. So what are the treatment options? I'm just marking. Okay, blood transfusion, low dose radiation therapy, or radio frequency ablation, then splenectomy. So these are my keywords. Okay, so that is all about text D. Yes. Then now we are moving to the first question. So we have 20 questions in total and 15 minutes. So what about the category of question? 1 to 7 set of questions that can be called match the following. Okay, so maybe it is in text A, B or C, C or D. You can locate your answers. Okay, so the first one. So when you read a question, always mark keywords from the question. So may I know what is your answer for the first question? The link between viral infections and hypersplenism. So my keywords, link, then viral as well as hypersplenism. Okay, hypersplenism. So what is your answer? May I know your answer in the comment box? Any idea? Yes, it is from text B. Very good, 𝐉𝐶. That is from text B. So where is it mentioned in text B? Okay, viral infections, which is only mentioned in here, text B. Infections, viral infections. So what is the connection with hypersplenism? It is one of the cause. Okay, so that is from text B. So my answer is B. Okay, very good. Then second one. What method is usually executed to treat diffuse peritonitis? Okay, so what are the keywords? Method, executed, then peritonitis. So what is your answer? Okay, Jubi, very good, dear. It's option, it's text B. Then second one. Okay, so what method is usually executed to treat diffuse peritonitis? So that is from text C. Okay, see, diffuse peritonitis develops. So here comes the keywords from the question. Okay, so what method we are doing? You can do splenectomy. Okay, so that is from text C. So we just need the, okay, text, that is text C. Then third one. Okay, 𝐉𝐶, very good. It is text C. Third one, a final course of action to be taken in the management of hypersplenism. So final, then management, then hypersplenism. So what is the correct answer? A final course of action to be taken in the management. So where they have mentioned regarding the management or the treatment. Okay, so the treatment which is mentioned in text D. Okay, treatment, management. So my answer should be D. Then fourth one, what is the main purpose of spleen? Any idea? Fourth question, what is the main purpose of spleen? So where they have mentioned about the spleen, purpose of spleen? My keyword spleen and purpose. Okay, an idea? See, from text A, when your spleen becomes overactive in doing its job, its job is to filter out old and damaged cells from your bloodstream. When your spleen becomes over enthusiastic about filtering your blood, it removes too many blood cells too soon, leaving you with deficit of blood cells. Okay, so that is from text A. So my answer is A. Then fifth one. Yes, 𝐉𝐶, text A. Which medications are recommended to taken by the patient's post-splenectomy? Okay, medications, then patients, then post-splenectomy. So what is your answer? Fifth one? Okay, so it is all about the management, right? Yes, so what are the medications mentioned here? Any type of medications mentioned? In some cases, they may prescribe daily prophylactic or preventive antibiotics. So that is all about text D. Then sixth one, when shall one undergo splenography? Okay, so my keywords are when, splenography. So that particular word is only mentioned in which text? Okay, so which is in text C. See, splenography. So my answer is, it is C. Okay, so that is from text C. Then seventh one, factors that lead to the formation of hypersplenism. So what are the factors? Factors lead to formation of hypersplenism. These are my keywords. Any idea? Seventh one. Seventh one. What about the seventh one? Okay, Jubi, what about your seventh one? What is your answer? Hi, Sonia. Good evening, dear. Okay, so seventh one, it's all about, okay, the title. What is the title? Causes of hypersplenism. So what are the causes? What are the factors affecting? It is liver disease, infections and autoimmune diseases and inherited metabolic disorders. So my answer is B. Okay, so these are my answers. Any doubts? 1 to 7. Okay, so now we are moving to the next set of questions, that is 8 to 14. I can call them short answer questions. Okay, so what is the important instruction here? Don't forget that, okay? Word or a short phrase. So you can write it in a word or a short phrase, which means maximum 3 words. And don't repeat the words, okay? If it is not a name, okay, if it is not mandatory to repeat the words, you don't have to repeat it. Okay, don't ever separate words. For example, what can I say? A particular word that is a combination, or it is a single term or a single word. Okay, don't separate the words. Okay, if it is separated, then you can write that single word into your answer option. Otherwise, don't separate words. So 8th one, the kind of body tissues which get targeted and destroyed by low dose radiation therapy. So my keywords, kinds, then tissues, then radiation. Okay, so what is your answer? Any idea? 8th one, kind of body tissues which get targeted and destroyed. Okay, Ammu, you got 7 out of 7. So glad to know that, dear. Okay, Anu, tumors. So where did you get that answer from? Tumors? Okay, kind of body tissues. So yes, that is mentioned here in text D. Okay, so what is mentioned about? Tumors, low dose radiation therapy or radio frequency ablation. These are two methods healthcare providers use to target and destroy body tissues such as tumors. So what is the correct answer? Tumors. Okay, so these are the keywords, right? Target, destroy. Okay, and yes, so this answer is all about tumors. Then the next question, who gets weakened gradually by splenectomy? Who gets weakened? So my keyword, who, then gradually splenectomy. So what is your answer? Who gets weakened? Any idea? Okay, Binsi, very good. Yeah, it's tumors. Yes. So what about 9th one? Who gets weakened? Okay, so that is also in text D. Okay, so splenectomy is the keyword from the question. Okay, so what is your answer? You can live without a spleen, but it does weaken your immune system. So who gets weakened? Immune system should be the answer. Okay, Reshma, Ammu, Anu, yes, Alfie, Binsi, okay, Sharmi, Jubi, Grishma, yes, immune system. Very good, excellent. Okay, Soumya, immune system. So immune system should be the correct answer. It is from text D. Then 10th one, the condition that is characterized by decreased count of white blood cells. So what is the condition called? Condition that is characterized by decreased count of. So my keywords, condition, decreased white blood cells. Any idea? What is the condition called? Okay, Anu. Okay, Reshma, very good. Okay, Ammu, yes, it is leukopenia. Okay, Binsi, leukopenia should be the correct answer, which is mentioned in text A, right? Yes. So answer should be leukopenia, low white blood cell count. So simple. Okay, so the next one, 11th one, overproduction of which components may add to the over volume of the spleen? So my keywords, overproduction. So question is asking you clearly regarding which components. Okay, so which components? Which components? Okay, Kamlesh, it is text A, leukopenia. Yes, dear. Okay, Jubi, leukopenia. Yes, Grishma, leukopenia. Okay, so what about 11th one? Overproduction of what? Which component? Yes, Anu, Reshma, Ammu, it is cells. Okay, Binsi, cells. Okay, Doshna, cells. Answer should be from text B, cells. Okay, so where is it mentioned? Cells. The overproduction. So those are my keywords, right? Overproduction of cells. Okay, so you can write what? Cells should be the correct answer. Okay, I'll show you the answer. It should be cells from text B. So answer is cells from text B. Then 12th one. Okay, Alfie, Juby, Sharmi, very good. Okay, Kochus, very good. Cells should be the answer. Okay, 12th one. The factor through which hypersplenism is classified into 3 types. Okay, so my keywords classified 3 and types. So these are my keywords. Any idea? 12th one. Okay, Vidya, 10th question, answer is leukopenia. Okay, very good, dear. So what about your next one? 11th one and 12th one? May I know in the comment? 11th and 12th. So what about the 12th one? The factor through which hypersplenism is classified into 3 types. So what is the factor? Okay, so which is from text A. So what is the factor mentioned here? Okay, there are primary and secondary. So these are the 3 categories. Hypersplenism can be classified into 3 categories by its etiological causes. So what is your answer? On the basis of etiological causes. So this should be the answer for question number 12. Okay, etiological causes should be the answer, and it is from text A. 13th one. Okay, so you can write also the causes, okay, because question is clearly asking you regarding the factor, so there is no relation with causes. Okay, if it is cause, yeah, you don't have to repeat it, but in the question, the paragraph, it is all about causes, so that you can write etiological causes. 13th one, the condition defined as the building up of pressure in the blood vessels that runs through the spleen due to chronic hepatitis or cirrhosis is called dash. So what is it called? The condition defined as building up of pressure. Okay, spleen, then cirrhosis. So what is your answer? May I know? 13th one. Okay, so the condition, it is mentioned here in text B. So may I know the correct answer? Portal hypertension. So yes, it is the correct answer. Very good, 𝐉𝐶. Answer should be portal hypertension, that is mentioned here in liver disease. Okay, so what is the correct answer? Already when you mark the keywords, we have marked it. Where is it? Yes, here. This is called portal hypertension. So what is portal hypertension? See. Okay, so conditions affecting your liver such as chronic hepatitis or cirrhosis can cause pressure to build up in the blood vessels that run through your liver and spleen, and that's called portal hypertension. Then the 14th one, what measure has to be taken if the splenic injury shows blush on CT? Okay, so what are the keywords? Blush, CT, measure. Okay, so I know that, which is only mentioned in text C. So what is the correct answer? Okay, answer should be, okay, angiography embolization. So what is the correct answer? 14th one, angiography embolization from text C. So why it is angiography? See the keywords from the question. See, blush on CT. So those are my keywords. So I got the answer from text C, and my answer is angiography embolization. And the next one, so it's over the short answer questions. So now we are moving to the next one, that is 15th. In dash, your provider will restore your low blood cells counts with donated blood. So what is the correct answer here? 15th one, any idea? Okay, Juby, what is your answer? 15th one. What about Grishma, 𝐵𝐶, Soumya, Vidya? 15th one. In dash, your provider will restore your low blood cells. Okay, so that is, what is the correct answer? It is from text D, and that answer should be, okay, blood transfusion. So here, this is a particular treatment. Okay, blood transfusion is a particular treatment. Here, your provider will restore your low blood cell counts with donated blood. Okay, so he said, do you want to repeat that particular word into your answer option, or is that transfusion? Any idea? What is the correct answer? Is it blood transfusion or transfusion? So answer should be blood transfusion because that is the name of a particular treatment. Yes. Then 16th one, low dose radiation therapy or dash are two methods healthcare providers use to target and destroy body tissues such as tumors. So what is your answer? 16th one, any idea? So my keywords, low dose radiation therapy, then target, destroy. Already we have dealt with this question earlier. So 16th one, my answer is radio frequency ablation. Okay. So yes, radio frequency ablation, and that is my answer from here. Okay. So that answer should be okay, some technical glitches. 1 second. Yes. So my answer is radio frequency ablation from text D. Okay, so this is my answer, radio frequency ablation. Clear? Okay. So now the next one, 17th one. Hypersplenism may lead to the deficit of red blood cells called dash and make them feel tired and cold. Okay, deficit. So these are my keywords, deficit, tired and cold. So what is the correct answer? Blood cells cold dash. It is from text A. My answer is anemia. Low red blood cell count. So my answer is anemia from text A. Okay, 18th one. In some cases, the providers may prescribe daily prophylactic preventive dash to take after your splenectomy. So what is your answer here? 18th one. You can take, yes. Already we know that answer. It is antibiotics. See? Okay, so these are the preventive medicines, antibiotics. Question number 18. Then the next one, second last one. We can treat for other injuries if the abdominal CT scanning shows no dash. So what is it? What is the missing word there? Okay, so which is from text C. So answer should be splenic injury. Okay, answer should be splenic injury. Okay, Anu, noble, yes, it is splenic injury. Very good. Yes, Reshma, splenic injury from text C. And the last question, viral infections such as mononucleosis and HIV, bacterial infections such as tuberculosis and dash, and parasitic infections such as malaria and toxoplasmosis stress the immune function of the spleen. So what is the correct answer here? Question number 20. Any idea? Question number 20. Okay, so which is from B. Okay, so which is from B, and that answer is okay, endocarditis from infections. Okay, from infections, it's all about endocarditis. Okay, answer should be endocarditis, and that is the correct answer. Okay, so that's all about today. Okay, so as usual, we have a gift for you. So Neetu ma'am is coming with another writing depiction today at sharp 10 p.m. So stay tuned. So God bless you all. Thank you.